You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Azita Vakili. We've invited Dr. Vakili on the program today to discuss who's a candidate for dental implants. Dr. Vakili, welcome to the program.
Thank you, Randy. It's a pleasure to be here.
Now, before we get into today's topic, tell us about your practice.
Well, Randy, I'm a prosthodontist by training.
Yeah, what is a prosthodontist?
Oh, well, it's a long story, but I'll make it short.
Okay.
I had my dental training at the University of Pittsburgh, and after dental school, I received 3 additional formal training as a residency.
Okay.
In a combination of University of Rochester and University of Pittsburgh. And I received a certificate in prosthodontics. Now, prosthodontics is a field of dentistry. It's a specialty known by the American Dental Association. And it has to deal with replacement, reconstruction, and rebuilding of teeth.
Of teeth,
so
okay.
In my practice, I can focus from a single tooth challenge cosmetic veneer to a large case of, tooth attrition and rebuilding and redesigning a smile to replacement of teeth.
So you specialize in dental implants, for the most part?
It's one of my subspecialties, yes.
Okay.
As a prosthodontist, I got the training to learn how to replace, where to replace teeth,
okay,
and where to rebuild the bite and make it beautiful and natural.
All right.
And then fell into my lap of, well, they're missing teeth. Should we stick with the traditional dentistry of preparing and basically cutting healthy teeth to replace them, or can we use other modalities?
So as you say, you place the implant, do the surgery.
Yes.
And then you put the tooth on top.
And then I restore them later.
And you say that's not how it's normally done. You go to 2 separate dentists?
Well, typically it's been the routine that, patients seek dental implant placement in another surgical practice, either the oral surgeon or the periodontist, and then the prosthodontist or general dentists typically replace and restore the crown. In my practice, I do both. Having said that, doesn't mean that I don't seek help of my other colleagues. There are cases that it is complex, and there are cases that I do ask for other opinions, and I'm proud of the fact, if somebody came and told me that they know it all and they can handle every case, I'd be leery.
Okay.
So I want to know, the areas that I'm very comfortable, I can go ahead and restore and replace the implants myself.
Now, dental implants have become more mainstream
Absolutely.
than ever. How long have they been around, by the way?
Oh, over 30 years, easily.
How long have you been involved with dental
I've been involved in dental and implant dentistry about 20 years, since my residency at University of Pittsburgh.
Why implants? Why do you like it so much?
It changes lives. From the time you replace a tooth with the most natural way to replace them, where it feels like their own.
Okay.
It feels like your own. It doesn't feel like it's a foreign object. It doesn't move in the mouth when you speak. It doesn't, you don't have to take it out and put it in a jar when you sleep.
Okay,
you know what I mean? That's as natural as it can get. And that changes lives. People's level of confidence and just self-worth tremendously increases.
Now, knowing I was going to interview you, went on the internet, 35 million Americans wearing dentures, missing teeth.
Right.
So it's a big problem, I guess.
It's a huge problem, yes. Just imagine, of all these people, how many gallons of dental adhesives do they swallow?
Okay.
Okay? What does that do to your digestive system? Now, take a step back. You have loose dentures, you're wearing these, and I see the patients in my practice all the time. The gums and the jaw ridges are sore. They avoid public eating because it's embarrassing for teeth to move. Many of them have curtailed their lifestyles to what they call the loosey-gooseys that they have. Yeah, that's what they name it.
Okay.
And just imagine if we can just anchor these dentures.
Now you say with just 4 implants, dental implants on a lower denture.
Right.
That's all you need.
Many times, that's all you need.
Do you think people count their teeth a denture wear?
Yes, they do.
And they say, oh man, that's too expensive.
Absolutely. They do, but that's a misconception. You don't need to replace every missing tooth, especially in case of a denture wear with an implant. Now, dentures are loose. They're annoying. They can't eat carrots. They can't eat apples or corn on the cob. Because they are loose, because they're moving all the time, if we can just anchor it tight, and man, do they make the difference.
You say,
they feel the difference.
Now, of all the areas of dentistry, and you practice kind of all the areas of dentistry, are the dental implant patients the happiest?
They
and the
are,
outcome?
Besides the extreme cosmetic patients that we treat, yes, they are. Besides,
are they the
they're
most
two
appreciative?
Absolutely, they love it.
Okay.
They love the fact that I went from a partial denture that I wore for 40 years now to fixed natural teeth that I don't have to worry about. It's amazing for them.
Do they fall out?
Well, Randy, dental implants historically have a 98% success rate.
Okay.
Okay, that means there's a 2% chance. Very rare.
So if you decide to do it, it's probably not going to fall out. I mean, if they're a candidate.
No, if once the patient is candidate and we have the proper information that we need for their health, for their bone quality and all that we gather ahead of time, very rare, very rare.
Okay, what are the different categories of implant patients you see?
Oh gosh, I see young patients who've lost a front tooth due to a bike accident or trauma, where we need to replace one implant. And then I see the other end of the gamut, patients who've worn dentures for 20 years and they have no teeth and they've had it with their dentures.
Okay.
So these are all and anything in between are categories.
What about the person that and I know a person like this. They go to their dentist and they say their teeth have to go.
Right.
So they have to make a decision between a denture or a dental implant. And I wanted to ask you, I'm supposed to ask you, but they have bad gums. Can they still get dental implants?
Absolutely. Those are the classic ideal patients in my
Really?
book. Yes. I just treated a gentleman last week where his own natural dentition were hopeless because of bone loss and gum disease.
Okay.
But he had plenty of bone to retain dental implants. And one of the things he told me, he said, I have avoided dental treatment for 40 years. Now I want them fixed. And I want teeth.
Okay.
Okay. So
is it like getting your teeth back? Sorry to interrupt, but it's like getting your teeth back.
Yes, it is. So what we planned for him was we got rid of the bad teeth, basically.
Okay.
We placed 8 upper implants and 6 lowers, same day.
Same day?
Yes. We restored his smile with a with temporary teeth.
Okay.
And he was here yesterday in my practice and he said, you know, it's a miracle. I've been waiting to have pain and I haven't had any. I haven't even taken the pain medicine you gave me.
It seems painful, though. I mean, nobody likes going to the dentist.
No.
You would agree with that?
Absolutely.
But the pain,
it's not painful at all. That's one of the misconceptions with the medications that we have and the way we control the swelling, which causes most of the pain. Most patients don't complain about pain.
It's not an issue.
Not an issue.
Okay, now what about those people like my mother, knowing I was going to interview you? She is 73, and that's young today.
That's very young.
But she has had dentures since she was about 27, she thinks, 27,
Right.
28. She goes, Randy, I'm too old.
Never. Age is not an issue.
Is that something that comes up a lot, where people self-diagnose and say, I'm too old?
Unfortunately, it is, and I don't want the age to be a limiting factor. It is not. We always check the medical history very carefully. We get clearances from the medical doctors to be sure that they are healthy and they
Now,
can...
she had a medical doctor that said she didn't have enough bone, probably, to do it. Is that accurate, not accurate?
No, not accurate anymore. We have so many new techniques of grafting and regrowing bone.
Okay.
Okay? It may elongate the process a bit, but it's not impossible.
Do you have like, not synthetic materials, or some type of materials?
We have all sorts of materials.
To build bone.
We can use the patient's own bone. We can use bone from a jar, what I call a synthetic.
Okay, okay.
And we can use processed bone that's gone through processes where there is no viruses, no bacteria, no live cells, but it works as a scaffolding and it invites the patient's own bone to grow onto it and replaces it. So we have lots of different techniques.
Now I'm going to back up for a second, but somebody missing a tooth in the front, very common, I guess.
Very
athletes. Common. But a dental implant seems like it'll stick out like a sore thumb. A
little
phony.
I have a photograph I will show you.
Okay.
You will not be able to pick up which one is the dental implant, which one is her crown, a natural root, a natural tooth.
Okay.
It's the placement. It's the placement and position of the implant that will dictate you how natural it'll look at the end.
I've had cosmetic dentists on this show, and I'll ask you the same question. Is there an art to dental implants? Is it art and science?
In dentistry, it is art and science.
Okay.
All the time, hand in hand. You have to have an artistic eye to look at the face and say, what do I want out of this face? You know, I've had patients who are there in their late 60s and have had beautiful services from plastic surgeons and have done their face, and it's gorgeous.
Okay.
Then you look at this part of the face and it doesn't match.
Okay.
You see? And we rejuvenate the smile. We design it so it matches this whole beautiful masterpiece picture that they created. Then everything matches and it looks in harmony.
So the whole top, I see these removable. I feel like I could spot them.
Yes.
A few yards away. So is that a common area where you give implants?
No.
All the way across?
It's common that we replace the whole upper arch full
Okay.
denture with implants.
Okay.
And then we restore it with beautiful ceramic as it is used in cosmetic veneers.
Okay.
To replace them with fixed bridge work where you couldn't spot it. All you could see is a beautiful, healthy, clean smile.
All right.
And that, you know what? That takes about 30 years off a person's face.